Hello everyone, this is Dr. TSR. Today, let us study about the respiratory system, the physiological changes during pregnancy. Right? So, what happens during pregnancy is this is the lung. So, there will be widening of the whatever the outside, the widening of the xiphisternum angle. The xiphisternum angle will widen. So, whatever the circumference is there, the circumference will increase by 6 centimeter. So this diaphragm is diaphragm is pushed up. Diaphragm is pushed up by 4 centimeter. Okay, so that is the thing. There is widening of xiphisternum angle widens. So the circumference is there. The circumference increases by 6 centimeter. Diaphragm is there. Diaphragm pushes up by 4 centimeter. Okay, so this is about the related to centimeters. Then coming to when the diaphragm pushes up, so what happens to the residual volume? The residual volume will reduce. What happens to the residual capacity will reduce. What happens to functional residual capacity will reduce. What happens to the total lung capacity also will reduce. So what remains same is vital capacity. Vital capacity remains same. What increases is tidal volume increases and minute ventilation increases. Okay, see this is residual volume. Residual volume will reduce. All thing which is related to residual will reduce. Residual volume, residual capacity, then functional residual capacity. Then comes the total lung capacity. What increases is the tidal volume and then minute ventilation. Okay, so what remains same, like respiratory rate will not alter more. Okay, so then what is the hormone of pregnancy? That is progesterone. This progesterone is going to sensitize the carbon dioxide in the medulla. The medulla is the one which is contained in the respiratory center, right? So when it sensitizes the medulla, so that there will be increase in the depth of breathing and as well as hyperventilation in the mother. So when there is hyperventilation, so when the depth of the breathing also increases, there is more release of carbon dioxide to the outside world. That means PCO2 in the mother will reduce. This is what is called as respiratory alkalosis. When there is respiratory alkalosis, this is compensated by metabolic acidosis. So there is decrease in the level of bicarbonate. So pressure of bicarbonate also reduces. Pressure of CO2 will reduce. Pressure of bicarbonate will reduce. But pressure for oxygen PO2 will increase. This you should know when you are analyzing ABG. So right, okay. So then what is the importance of all these things? So even because of this pregnancy, there will be mucosa. There is a mucosal edema. So there will be mucosal edema also. The respiratory glottis, all those edema will be there. Tongue edema will be there. So you have to consider early intubation. Okay, in this patient, because of the edema, there will be difficulty in intubation. Next thing is there is already reduction in the residual volume. So when you want to intubate, you have to pre-oxygenate more for the patient. So pre-oxygenation is must. Pre-oxygenation, early intubation and mucosal edema and EBG parameter. What is the physiological thing? Decrease in the PCO2, decrease in the PHCO3 bicarbonate. This thing you should know. This is all about the respiratory system. So this is Dr. TSR. Hope you liked this video. Thank you so much.